says we're being live streamed, but it's not quite ready yet, so. All right, perfect. And I'm just gonna pull up Facebook's version so that if I get any questions on Facebook, I can answer those as well. There it is, perfect. Answer those as well. There it is, perfect. Good. All right. So welcome everyone to another one of our crash course sessions. In this one, we're going to be doing an update. I will have some new crash courses coming next month, but there's a couple of things that are really important in these last few crash courses that are just really, really lagging behind the times. You know, these were among the first crash courses I did. Chakras, I think, was the 6th, and we did 3 pathways a couple of weeks ago, which was actually, I think, the 3rd or 4th. So some of the information out there has changed. Some things have changed, and it's really important, especially when you're dealing with anything health related, that you stay on top of it. Typically, things in the health field will change every 2 to 4 years based on what we're seeing, what other people are seeing, how things are going, and you know, what kind of developments we've had. So in a small way, redoing this is a way of introducing the pinnacle to it, although the functionality is pretty much the same. But it's also looking at things like the soul star chakra, which is the 8th chakra, which until now we've not really looked at all, and we've in fact just told you to ignore. It's also about updating some of the information on the alternative treatments. So in this course, we'll be talking about things that are not just microcurrent. How do we deal with chakras without microcurrent? So that's an option there as well. And updating some of those because some of them were missing. We didn't have anything for, say, the crown chakra. So there's lots and lots of different things we're going to be covering today, and just kind of talking about what chakras do and how they work. I'm going to start recording this now, and then we will get going because we are just about right on the nose where we need to be to get this started. Okay, welcome everyone to our chakra crash course update. This is updated for 2022, so it's been a couple of years. We haven't, since we last did the chakras, and there's definitely some stuff that's changing here. As with all crash courses, I want to answer questions as we go along. So if you have a question that comes up in the moment on a slide, post the question. I've got both my Facebook chat and I've got my Zoom chat open. You've got the chat box or the Q&A on Zoom and the comment on Facebook. You can use either one of them. I don't mind. I'm going to check both. I just want to make sure that the questions are answered in the moment because it's better for those that are watching to kind of take that in and understand it if you're rewatching the replay. Instead of kind of trying to catch it all up at the end. So this goes a little bit against how we usually do webinars where we ask you to hold your questions to the end, okay? So if this is your first crash course, and I know it is for some of you, welcome. In our crash course video series, which is a couple of years old now, we take a deep dive into a specific protocol or condition, and I teach it all live. So this is this means that what might normally be a 10 or 15-minute training video often ends up being about an hour to an hour and a half, depending on questions, depending on the complexity of the protocol. Because the concept here is that we cover everything. As if you were brand new to this day, you just got your device today, you unboxed it, and you're wondering how to make it work. So what we're going to be looking at here is we're going to be looking at the chakras. And the chakras are used for a whole wackadoo of stuff that we usually might not even look at, but it's got some imperative kind of functionality to it that goes beyond just emotional health, goes beyond physical health. It's kind of about balancing it all. And I often tell people, don't run away from chakras, don't think about them as something religious or spiritual. While they can be, they are also just a mechanical function of our body. And as long as these chakra wheels are turning, we are in optimal energetic health. So in this video, I'm going to go over other methods beyond the Avazia devices. And this is mostly because the only way to do the chakras effectively is to have a Pro Sport 3 or an Avazia Life Pinnacle device. So there are some other options that we will cover as to how you can help balance your chakras outside of microcurrent. And for the first time, we're also going to be discussing the 8th chakra, which is known as the Soul Star or Soul Star chakra. This is a chakra that we have not looked at in any previous video. So this is going to be very interesting for a lot of people. And I was interested as well, just to be highlighting exactly what it can do, because there's quite a lot of stuff that I had not even really looked at, especially when it comes to the physical manifestations of that chakra. Okay, so why don't we dive in and talk about chakras? So first off, what are chakras? So literally speaking, the word chakra from Sanskrit translates to either wheel or disc, but it is supposed to reference a spiritual energy center within the human body. And there are 7 along the spine and 1 up here. It's between 6 inches to 2 feet above your head. Now, when we think of our chakras, we don't need to think of them spiritually. The chakras are fundamentally energy centers in our body. These are responsible for governing organ systems. And when these chakras become blocked, then our energy flow and bodily function also becomes blocked. Now, we know that the body is electric. This is what we talk about all the time. If you are watching this in the replay library, I don't think there is a single video in this library that does not talk about microcurrent and therefore about the electric body. Now, when energy is restricted, our health becomes impacted. There is a direct correlation between our cellular communication and our body's overall well-being. So the physical and the emotional collide here, and they do in almost all things pain. No matter what people say, physical problems have an emotional component. An injury is often tied to memory. The moment that injury occurred, an emotional memory is created. And the same goes for other health concerns too. Stomach issues, chronic shoulder pain, sciatic pain, nerve pain. When that pain started, or when you received a diagnosis of that pain, some sort of emotional trauma was created that is associated with it. Ignoring that the emotional and physical are tied together can be detrimental to your health and healing journey. But the chakras give us a pathway to address both at the same time, which is quite a rare opportunity, but something we definitely want to take full advantage of. So over the next, I think 8 or 9 slides, we're gonna dive into what the different chakras do, okay? And I encourage you to ask questions as we go along here. You need to kind of pick and highlight whether these chakras are what are causing you problems, okay? So the root chakra is the first chakra. This is located at the base of the spine and the pelvic floor and the first 3 vertebrae. Now, the root chakra is responsible for your sense of safety and security in the world. If there is an imbalance in the root chakra, you may experience anxiety disorders, fears, or nightmares. Physical imbalances may manifest as problems in the colon, with the bladder, with elimination, or with lower back, leg, or feet issues. In men, prostate problems may occur as well. And eating disorders may also be a sign of a root chakra imbalance. So all around, there's a lot that the root chakra can do negatively for us if it is out of balance. Now, think of this, think of the name here. This is the root chakra. This is the base, the core that holds up all of the other chakras above it. When the root chakra is out of balance, chances are all of the things above it are going to be out of balance too. And this is a common theme you're going to be able to follow through the chakras. If one chakra below others is imbalanced, the others will be impacted too. So it's very important that you try and think of what exactly could have started your issue, where your issue might be. If you feel impacted by some of these issues listed here on the root chakra, and you feel you're going to resonate with a bunch of other things as well, don't forget that the root chakra drew your attention as well, because this may be the starting point. You've got to treat it from the root if you want to heal the tree, right? So let's move on. The next one along the line here is the sacral chakra. Now, this is the second chakra, and it's known as the creativity and sexual chakra. It's located above the pubic bone and below the navel, just about 3 inches below, and it encompasses the genital region. When this chakra is out of balance, a person may experience emotional instability, fear of change, sexual dysfunction, depression, and even addictions. It is also associated with lymphatic problems. So if you have a lot of edema, a lot of swelling, the sacral chakra can be connected here. Now, a lot of the sacral chakra can be broken down to stifled expression when you're not able to just let it all out and express yourself in the way that a child might. Then in this case, you are inadvertently stifling this chakra. So this is one to pay a lot of attention to. Conditions that may be associated with this would be things like endometriosis, infertility, right? Things along those lines that could have an impact from this level, this like chakra location. Next along the line is the solar plexus chakra. So this is located around the navel in the area of the solar plexus and up to the breastbone. It is a source of personal power, and it governs self-esteem, as well as the power of transformation, the power to change and become something else or someone else. So this chakra also controls metabolism and digestion. So people that are struggling with weight, as well as people who have digestive problems, may have a solar plexus chakra issue. If you're experiencing a chakra imbalance here, you can suffer from low self-esteem, you can have a lot of challenges making decisions, and you may have anger or control issues. This means that your solar chakra is blocked and it cannot achieve its full potential. Physically, this chakra will impact digestion, and anyone struggling with digestive health concerns may have a blocked solar plexus chakra. So digestive health concerns to me would also encompass things like Crohn's disease, ulcerative colitis, things that impact your digestive system. Not necessarily just that you are having a hard time digesting foods, but things that impact that digestive system will definitely be flaring up here. Something like heartburn, right? If you have acid reflux, it's being impacted. Your digestive system is being impacted negatively. That would be a solar plexus chakra problem. The heart chakra is the next one up, and this is not located on the heart itself, but on the center of our chest. The fourth chakra here connects the lower and upper chakras. It is like a highway between the two halves of the body. And a blockage in the heart chakra will often cause issues on both sides. It's going to cause a variety of emotional and physical problems. Respiratory ailments like lung infection and bronchitis, repeated circulatory and health-related problems, feeling closed off, jealousy, a fear of intimacy. These are all things we have to be aware of that could be playing a part in this chakra's energy, capability, potential. People that have gotten COVID multiple times, this is something that I feel is a very important one to look at. There is, in today's climate, there is no chakra that's going to be more potently used. If you had balanced chakras before, this one is one where you're going to you're going to have kind of more problems associated with this. We have to be aware that social isolation plays a part in this, though that's changing a lot now, which is great. The last few years were terrible. The amount of people I saw that really needed to be working on their heart chakras because they felt so alone, so isolated. And then it contributes to this downward spiral because you're taking this issue and you're adding on the other issues too. You get your social isolation, you get your depression, your anxiety that makes you feel really down and alone. And then that leads to a vulnerability to respiratory problems, a decreased circulation, which leads to further respiratory problems and so on. So thinking of the body as a wholly connected thing and recognizing this is super important here. Remember, if you have any questions as I'm going along, drop them in the moment. Don't save them to the end. It's going to be better for everyone that way. The throat chakra is the fifth chakra, located at the center of the neck at the level of the throat, and it's the passage of energy between the lower parts of the body and the head. Now, the function of the throat chakra is driven by the principle of expression and communication. The throat chakra controls the thyroid gland and the endocrine system. If you have an issue with hormones, then the throat chakra is going to be playing a role here. That means that it is responsible for the regulation of flow of hormones and the function of all matters of the throat and head, including the trachea, the mouth, the esophagus, teeth, so dental problems, nose, ears, and carotid arteries, which can even kind of transfer over as well onto vagal nerve disorders. So think of the throat chakra as a very, very big one with a lot of stuff potentially going on for it. Now, physically speaking, an unbalanced fifth chakra can cause you to experience consistent fatigue, headaches, and even speech impairment. In some cases, it's not uncommon for even more serious physical effects to include tinnitus, autoimmune dysfunction, and hypothyroidism. So lots of things can be going on here. The effects of the imbalanced chakra may also manifest in less physical ways. And in the case of the throat chakra, a blockage can initiate behaviors indicative of insecurity and a lack of control, such as manipulativeness, lying, arrogance, anxiety and or fear, diminished self-esteem, and compulsive or excessive eating. So there's a lot to unpack here, but the throat chakra being blocked can block your physical expression. And when your physical expression is blocked, it can lead to us trying to seek other ways of getting approval. So exaggerating things just a little bit, right? Just to make them seem more interesting to people. Lying, just to make these things seem more interesting to people, or to get away with something that you know you shouldn't be doing. Manipulating people, whether it's friends, family, parents, if it's there, if it's present, there is an energy blockage here. There's some problems going on that we need to be looking at. So there is definitely a lot to unpack with the throat chakra, and we don't want to kind of ignore too much of that. The next is the third eye chakra. So this is the sixth chakra, and it's referred to as the conscience. People often talk about the third eye, right, as being able to see more, to see beyond. Now the chakra here governs the pineal gland as well as your vision, your intuition, your memory, and imagination. A blocked third eye chakra can result in the following. It can result in insomnia. It can result in high blood pressure, sciatica, depression, anxiety, and migraines. These are things that we can look to the third eye chakra to deal with. We do a lot of treatments on the third eye. It's a good access point to the brain. In short, the reason is the pineal gland. The pineal gland is amazingly beneficial at regulating a lot of bodily function. And the third eye is a good access point to that, especially when you're using the BHE, because you can access it directly through the third eye. So when you're doing chakras, it's an absolute natural fit to include this in the protocol. The crown chakra is the seventh major chakra. It's located on the crown of the head, and it's associated with spirituality. Now, I hate saying it's associated with spirituality because I know I scare some people away when I say that. But remember that chakras have more to them than spirituality. They're a physical thing in your body, and they're absolutely something we should be paying attention to, regardless of your beliefs. A deficiency in the crown chakra tends to cause subtle systemic problems, such as depression and mental fog, chronic fatigue, migraines and other chronic headaches, greed, materialism. These can all be problems. In addition, sensitivity to light and sound, neurological or endocrine disorders, consistent boredom and frustration, and even a sense of unearned accomplishment can all be manifestations of a dysfunctional crown chakra. Now, an unbalanced crown chakra can also play a role in learning disabilities, comas, sleep disorders, and mental illness. So it's not something to ignore just because it says it's associated with spirituality. There's a lot that's going on here that we need to unpack. And here we go, onto the newest, just say newest to us, of the chakras, the soul star chakra. Now, this is often called the soul chakra or the soul or the star chakra, but I've seen it be the soul star. I wanted to give it both names so there was no confusion here. The soul star chakra is the area where you connect with spirit, with your higher self, with your higher being. However, it does have some very appropriate physical manifestations to it. The chakra's meaning here is about the idea of letting go of past wrongdoings and traumas. Often in life, we come across people, we come across situations and events in which we feel lost, in which we feel like people have done us wrong, that they have hurt us or they're not interested in helping us. And this really does stack up and it adds up. And people feed off of these. We don't realize our body is being fed off of by these events. And it really is a very draining experience for us. I just got a question here. Yes, I did mention the crown chakra just back here really quick, as you can see. So yeah, with the crown chakra here, this one being subtle systemic problems, including depression and mental fog, chronic fatigue, migraines, and other chronic headaches, greed and materialism, as well as the sensitivity to light and sound, neurological or endocrine disorders, boredom and frustration, and a sense of unearned accomplishment. It also tends to be connected to people that have learning disabilities, comas, sleep disorders, and mental illness. So yeah, no problem. I just wanted to go back just to make sure. So yeah, the soul star chakra is a lot about this concept of letting go of these past wrongdoings and traumas. And it's interesting because all of these other chakras, from root to crown, are physically touching our bodies. The star chakra is above our head. Now, we all know, or we may not know, that our bodies let off an electromagnetic field. We have a personalized electromagnetic field around us. This is why the Santa blanket works so well for so many things, because this personalized electromagnetic field can be reflected back onto our bodies for healing. But we also, this field is not just really close to our bodies, it is away from our bodies as well. So this field up here is probably what is feeding our brain. And this is sort of where this soul star chakra comes into play, and why years ago I ignored it, because I was like, well, it's not part of the physical body. But having this program in the device, having people look at it and tell me that they've used it and they thought it worked really well, has kind of brought into question, it made me realize, or re-realize, that our bodies have these personal electromagnetic fields. We have energy all around us, and we can affect that energy to affect our body. So the energy here, the energy with the soul chakra, it encourages you to let go of old attitudes that may otherwise have held you back in your current life. It is asking you to let go. This chakra being situated at the highest point of the physical body, it's around half a hand, well, about a half, not half a hand, so a hand width this way. So between 5 and 6 inches, but depending on the person, this is also being shown to be up to 2 feet above you. I don't know the correlation between distance there, but I would say that there's most people are going to be closer to, but depending on how much of this trauma you have, how far away is this, feeding that electromagnetic field above your head either way is going to be treatment enough in this way. Now, a dysfunctional soul star chakra includes symptoms of feeling of being not grounded. So this idea that you're constantly in fight or flight, this concept that your brain and body is off in the clouds. You're not in your physical body. Symptoms of confusion, directionlessness. So having a hard time knowing whether you want to make this choice or that choice. Lacking clarity and purpose. These are typical signs of a blockage as well. Physical symptoms here often include dizziness, which I would also include vertigo in, as well as headaches. These would need to be fairly common occurrences, or to be kind of an acute situation where dizziness and a headache have come on. But this disconnect between this electromagnetic field that essentially feeds our brain is what is at play here that needs to be addressed in this moment, in this chakra. So it's a very interesting chakra. It's quite unique, but it's got a lot to offer. So let's dive into treatment, but first we'll start with how to treat without microcurrent. Now, chakras are incredibly sensitive to frequencies, colors, and more. So attempting to treat chakras with microcurrent that is not specific to the chakra is not likely to have desired effects, which is why when we usually have substitutes, I'm saying in this case that the chakras can only feasibly be treated using the ProSport 3 and Pinnacle devices. However, there are a few other options to work at balancing chakras, and you may want to look at these if you feel you need some chakra work. So number one is crystals and gems, and number two is essential oils. Remember that everything in the world, everything that we come across has a frequency, right? Now, color has a frequency as well. And a lot of what the gemstone approach is this concept of frequency and timing yourself to allow your body to absorb that and to balance that. It's the same with essential oils. There's different crystals and gemstones. And of course, we'll be offering copies of these slides for people. So it shouldn't be a problem there to be able to see these different ones. You don't have to scramble to write them all down is what I'm getting at. But let's go through some of them here. Now, you'll notice that the color frequently changes to match the color of the individual chakra. I showed all those pictures of chakras as beautiful pictures, all of them kind of having a similar color to them in that way. As far as these go, the root chakra responds well to red jaspers, bloodstones, red carnelians, and garnets. The sacral chakra responds well to citron, carnelian, and orange calcite. The solar plexus chakra is citron, tiger's eye, and yellow tourmaline. The heart is rose quartz, rhodochrosite, emerald, and rhodonite. The throat is amazonite, lapis lazuli, turquoise, and aquamarine. The third eye is really only amethyst. I haven't found many others that seem to work quite as well. Luckily, amethyst can be fairly common to get. The crown chakra is selenite, quartz, now diamond. I've also read that from a metal perspective, gold can help with the crown chakra, but it needs to be good quality gold. So if you have any excuse to buy diamonds or good quality gold, just say that you need it for your crown chakra, and you'll be in luck. The soul star chakra has two gemstones, apophyllite and kyanite. Now, color-wise, these correspond to different things, right? We've got our red, yellow, orange, our green. For the most part, though, rose quartz is pink, but it seems to be matching the heart chakra pretty well. The throat chakras are a blue, and the third eye being purple, the crown being white, and the soul star is almost pure white. So it has quite a bit of a different selection there. Now, the way you do this, and let's just fire back here to this slide. You see here how this guy in this drawing has the different ones placed on the right spots on the body. Now, you don't want to do all these at once necessarily. The goal would be pick your chakra. So if you say had a third eye problem, you'd want to use the amethyst, place an amethyst on your third eye and wait 10 minutes, relaxing with your eyes closed. That is enough time to allow the energy to match the gemstone. So it's pretty simple in that way. As far as essential oils go, I have been trained in aromatherapy, but it is definitely not my strong suit. So I've been able to pull these from a book. What I could not find were essential oils for the soul star chakra. Though this time I was able to find some for the crown chakra. So, whereas before I couldn't. So for the root chakra, you would want to use rosemary, patchouli, sandalwood, or myrrh. For the sacral, sandalwood, patchouli, orange, or rose. For the solar plexus, orange, grapefruit, fruit, or peppermint. For the heart, rose, jasmine, and eucalyptus. For the throat, basil, bergamot, chamomile, cypress, juniper, peppermint, and sandalwood. For the third eye, bay laurel, cypress, elemi, and frankincense. For the crown, pure frankincense, myrrh, neroli, rose, spikenard, sandalwood, and vetiver. Now, any one of these that lines up, you really want to put a few drops on the right point. So again, for the third eye, a couple of drops of cypress oil, for example, placed on there, and then relaxing and calming. Essential oils can be combined with gems and crystals in this way. Okay, beyond the stuff that is not usually what we specialize in here, back to the microcurrent table. So when it comes to treating chakras with microcurrent therapy, there are only really 2 devices capable of doing that. Now, each chakra has its own frequency. And these frequencies have been programmed into your Pro Sport 3 devices as well as your Pinnacle, and you can use this to energize the chakra. First, these modes are the same. Whether you have a Pro Sport 3 or a Pinnacle, the names are the same. Do not be worried about any confusion here. If we ever tell you to treat a chakra, doesn't matter what device you have, if you have a Pro Sport 3 or a Pinnacle, these modes will match up for you. So the root chakra is CHRT194. Now these modes are quite a ways down in your device. I think I go up to find them quicker. Yeah, I do. I go up instead of down. It starts with CH step, but you're not using that right now. You want to go to your specific chakras. You've got CHRT194 for root. For sacral, you have CH SAC 210. For solar plexus, you have CH Sol RP 126. For the heart, you have CH HRT 136. For the throat, CH THR, short for throat, 141. For the third eye, you've got CH third 221. For the crown, CH CRN 172. And for the soul star, CH 8th 272. These modes are in sequence. As you find the modes, you can go down, which would be an up, it would be more thematic. You can go down to reach those different chakras, okay? So you need to be knowing which one you want to treat. Based on the symptoms that have manifested themselves, you pick the chakra that jumps out to you. And most of the time, that's pretty easy. You're listening or reading through the descriptions, you can pinpoint where you're at with the chakras and who you might be, what kind of person you might be. So as far as the treatment itself goes, there are 2 options to do it. Chakras are along our spine, so we really need to be treating the back region. So the simplest and most effective method here is to use the Via Chi and hold it on the front of the body on the corresponding chakra. So I use the third eye as an example here again. I take my Via Chi and I hold it right here. Now to do this, this means that I'm going to need to increase my power to maximum or until I can feel it. So I plug my Via Chi in, I set it to the right chakra, I point, and I increase the power to maximum or until I can feel the energy coming off of the Via Chi. Now, ideally, in this situation, you're going to want to sit there quietly for 30 minutes, 20 to 30, and just relax. But while you're relaxing, you need to think about the situation. You need to embody what happened. Whether it's a physical manifestation that you're trying to treat, or whether it's an emotional, I want you, when you're doing this treatment, to think about that. Think about what it has done to you, how it has affected your life, being this way or having this condition, and allow yourself to process that. Try and think of the memories that actually upset you. The things that upset you might be things like, you weren't able to go on this trip with your family, or you've never been able to play with your grandchildren because of this condition. Things that you feel have been taken away from you, let them go. Let them go into your brain when you're doing this treatment. It really does amplify things. It helps you to unblock it. You're then feeding it the energy you need, but you're also releasing that emotion that is at the core part of the trauma. And that emotion, again, it doesn't make you any less of a person to have an emotional reaction. In fact, it makes you normal to have an emotional reaction to trauma. And trauma being physical trauma, physical injury, physical condition, having a connection there does not change anything. It is all integrated. Now, clinically, that is what we do. 100%. I wouldn't want to go through all of the effort to do it with conductive pads on a patient. simply because it just takes a lot of work to get it all into place. So clinically, that's what we do and what we recommend people do as well. You can get your VHEs online if you don't already have one, and you can use them to very simply do these chakra treatments. The other option is to use the sticky conductive pads. You need to be able to place one on the back and one on the front of the body. Certain chakras are kind of off limits here. The throat chakra, you can't treat with microcurrents, it's too close to the thyroid. It's going to be harder with the third eye to get one on the back of your head if you've got hair, but it's not impossible. And of course, you can't use the conductive pads to feed the energy area of the soul star chakra because it is an electromagnetic field where you're going to stick the pads, right? So for things like the root chakra, the sacral, the heart, placing a pad on the front and a pad directly on the back, as if you drew a line through the body so that they were connecting by tunnel, is the way to go if you don't have access to a via chi. A common question is, can I do this with a chi wave pad instead? I mean, they're both PEMF, right? So it should be the same. But the surface area of the PEMF pad causes too much of an interaction with other parts of the body. If I place the PEMF pad on my heart chakra, I'm going to be inadvertently treating my throat and solar plexus chakra at the same time with the wrong frequencies. Even if I turn it sideways, the 2 inches, 2 to 3 inches of energy coming off the sides of the chi wave pad are going to bleed into other chakras, whereas the via chi is this focused, narrow beam. Okay, so these are your options here. You really want to kind of look through these, but this is not the whole protocol. So once you've done this, there is a program in the Pro Sport 3 and the Avasia Life Pinnacle called CH Step. This is key to the treatment and part of the reason why we can't use a Pro Sport Ultra, which is a Pro Sport 3 minus, I guess. It has about 11 programs instead of 53, and you can't program them in because CH Step actually moves through all of the chakras, working through all of them on the body. So if the previous chakra treatments directly on the affected chakra fill in the holes in the energy field, the chakra steps, or CH step, helps to normalize the whole system and bring the body back into complete balance. To do this, you run the CH step program with a conductive pad, one on each wrist, and allow it to cycle through each of the chakra modes. And this process takes roughly 7 minutes. If you look at it at the beginning, when you engage that mode at a comfortable power level, you'll notice it says CHRT. It starts at CH root. And once you've cycled through that, it'll move to the next chakra. When you see root pop up again and it's been some minutes in, you're done. You've gone through all the chakras and you've gotten back to the root chakra. Again, this should be done in a relaxed environment. Okay, so I forgot that the chakra course is a little bit shorter than the others because it's a fairly straightforward protocol with limited interaction with the device. So that is really how you perform the treatment. You need to do, and let's just recap this really quickly, off screen like that. So if I take my via chi, and let's use this as an example of the third eye chakra because it's the one you can see. I'll plug in the via chi. And when you're plugging in the via chi, you'll notice you've got this little twist wire. It's a really weird little wire here, right, with the 3 holes in it. So you want to make sure this lines up and you clip it in properly. Once you've got it clipped in, that does not mean it's connected because I can just pull it loose. There's a little plastic bit on the tip here. You need to twist it to the right and it will tighten and lock. This will prevent this falling out. Now this is an old via chi wire. The longer via chi wires have a longer protective piece here that thins out to stop this wire bending. The most common thing that breaks the via chi is people doing this with their wire when they're done, wrapping it around the device or bending it up in general. You want to make sure that you take care of the wire, okay? So we keep this here, we put it on, we twist it on. We plug it into the Pinnacle device and we scroll down to find the right mode. So I'm looking for CH third 221. So CH third 221 includes the right frequency for the third eye. So I'm going to place this on the third eye and I'm going to hold my plus button down until I feel it or until its maximum. Now I want this flat piece to be up against my head. The beam is longer and stronger out of this flat piece than it is out of the front. Not sure why, it's not supposed to be that way, but it just is. In all tests, we get further distance from the flat bit. So it sort of looks like you've got an elephant's trunk, but coming out of your third eye. It's dangling down like that. So I'm going to increase the power. Just by holding the plus button down. Don't press it. Pressing it one at a time takes forever. There's 250 power levels. So just hold it down. It'll go much faster. Interestingly enough, I can feel it. So 232 power, I stop because I can feel it. And then what I'm gonna do is I'm gonna hold the Viachi and I'm gonna just relax. And I'm gonna think about all the things that brought me to this point, what has been bothering me to do with the third eye, you know, for example, migraines and headaches. Thinking about those migraines and certain situations in which they've stifled me from doing what I wanted to do and caused me all these problems. And I'm gonna sit there quietly for 20 minutes. You can set a stopwatch on your phone, or you could just really kind of let it go. Most people I've seen fall asleep while doing the chakras, as long as they're not in awkward positions. You know, the third eye, if you're laying down, or your chest, and you've just got it positioned there, you can fall asleep easily with this on. Once this is done, once you've done your 20 minutes, you're going to turn the device off, because you're gonna have to reset the power, and you're gonna change the power up and adjust the mode to see if you can find CH step. There it is. And you've got 65 modes, you got a lot to search through, right? So CH step, initially, you can see it on there, but when I press this middle button here, it immediately says CHRT, because it started the chakra cycle. Then I'm gonna plug in pads, which I do not have at this desk. I'm gonna put my conductive pads on, and I'm gonna place one on the inside of my wrist here, and one on the inside of my wrist here. And I'm gonna adjust the power until I can feel it, and I'm going to let it run. This doesn't have to be done in as relaxed an environment, but usually at this point, you just continue to lie there. It's gonna take you in total around 30 minutes to clear one chakra and then balance out the body after you've cleared it, okay? So that is a physical run through of the treatment. Now, I've got a couple of questions here. Can we start off treatment with CH step before treating with individual chakras? I mean, we really use the CH step protocol as part of like the finishing up, the way that you wrap it all up together and make it make sense. If you do that first, I mean, you're kind of like trying to rebalance everything, and then you're going to something individually, you're gonna be far better off, in my opinion, doing CH step at the end. And then a question at the end, what are the third eye pads for? So you could potentially use the third eye pad. It's a sticky pad that's just for the third eye. You could potentially use the third eye pad for this protocol. The question is, will it get deep enough in to hit the pineal gland, which is, you know, somewhere mid-brain? Potentially. The third eye pads were actually developed as a replacement, though they didn't end up replacing them, for the trigeminal pads. The reason for this is that when we treat the third eye, when we treat the trigeminal nerve here, some people, close to 25% of people, will get headaches because their trigeminal nerve is going right through the temple, and it's hitting the temple, which is very sensitive and triggering a headache. So the concept was, what we were doing is we were taking these third eye pads and we were stacking them on top of each other, or we were cutting them down to reduce that impact. The third eye pads were developed as a replacement for that. They just haven't ended up actually replacing it. That being said, I do know that in the people that have used those instead of the trigeminal pads, they have definitely helped a lot with things like that. And some people use those as well for gamma to the brain, which doesn't necessarily require or reach the pineal gland. So it does ultimately depend on what you're trying to do there. Good question from Swamini here. How do you treat the soul star chakra with the Viachi? Okay, so with the Viachi with the soul star, I would lay down, place the Viachi above your head on the ground like this. That way, when you're laying down, you've got it in your energy field up top there, okay? You place it sort of sideways as well. But you wanna be laying down because you don't wanna be standing there like this. That's not gonna be relaxing. So lay down flat, place it above your head, one way or the other, and do the same thing with that 8th chakra. That is a good point. And the crown chakra is pretty much right on top here. So I tend to just rest it right on the top of the head like this. And that should be fine as well. Whereas the other chakras are all kind of spinally connected to your body. So that's a great question. Thanks for asking it, because it is a little bit more of a complex idea. Let's just pop back up to the slide. There we go. Slide. Okay, and we answered that question. Perfect. So if there's no more questions, I just don't know if I missed any. I missed some on Facebook. Sorry, everyone. I'm coming at them. So if one finds a connection with more than one chakra, should you work on just those, or is it a choice to just start at the root and work our way up to the top? If you find a connection with more than one chakra, I would start with the most bottom one that you feel you have a connection with. So if you think that the solar plexus chakra is the first one that you feel a connection with, start there and then work your way up. If the root is the first one, start at the root and work your way up. Doing a change daily on each point. What a place to be achieved for the soul star chakra. I'm glad I checked here as well as there. So that answers that question already. And what is the protocol for treating children? At what age can the chakra treatments be done? Theoretically, chakras are always there. They're always a part of our body. I would say that you can treat chakras at any age. You do not have to be concerned about that. Whatever age you feel you need to treat them at, you can treat them at. There is not going to be an age restriction like their chakras haven't fully developed or anything like that. Especially if there's some sort of trauma, physical or emotional trauma, it can easily be a very good idea to treat children with it. And perfect. Okay, so excellent session, everyone. Thank you all for joining me. We will be scheduling, as I said, some new crash courses next month. I wanted to do a couple of these important ones and get them out of the way, especially 3 pathways, but also chakras with the addition of the soul star chakra and just really kind of getting how it works. Yes, treating children will be the same time length. I know it might be hard to get some kids to sit still for 30 minutes.